Hi, my name is Jason Allen, and I'm a reporter with the Southland Journal. With me today is Jeff Good, president of Payless Hospital. Welcome, Mr. Good.
Thank you. Glad to be here.
I understand that you're a member of the local community as well as the president of Payless Hospital. Could you give us some insight into the hospital's 50-year history?
Sure. I've actually lived in Orland Park for almost 20 years now, and have worked for Northwestern Medicine for just over 13 and a half years. And last year, it was actually about a year and a half ago now, as the possibility of an integration between Palos Hospital and Northwestern Medicine, those talks started to happen. Our CEO, Dean Harrison, asked me as at the time a vice president at Northwestern Medicine if I would have an interest in moving into the role of hospital president after the integration was complete. And for the first few months, I served as co-president with Dr. Terry Moisen, who had been in the CEO president role for a number of years, and he was planning a retirement. So we served as co-president for the first several months that I was here, and then I moved into the president role in July of 2021. You know, it's an exciting time. March 19th actually was the 50th birthday of Palos Community Hospital, as it was known when it opened. And it was a roughly, you have to fact check me on the numbers here, but I think it was around a 273 bed hospital in its early days. And at the time of integration with Northwestern Medicine, now Northwestern Medicine Payless Hospital is a 425 bed hospital that's gone through, a couple of expansions and growth over the years. But that 50th birthday just passed on Saturday, which was the Feast of St. Joseph, which is a very exciting day for Palos and its history and its service of this community.
All right. What changes and advances have taken place since Northwestern took over in January of last year?
Yeah, we have three primary programs, clinically integrated programs that we look to excel and advance across the entire health system, and we feel that these programs, in and of themselves, are their growth is important to the communities that we serve. But when you're great in these three programs, it elevates the reputation and service of many other areas within the hospital. So our Bloom Cardiovascular Institute is one, so providing cardiovascular and enhanced cardiovascular services to the community, enhancing our neuroscience offerings to the community, and oncology is the third programmatic area. And those three, again, aren't at the exclusion of growing things like GI or primary care and other service lines. But as I said earlier, it's one of those philosophies that if we can really focus on those three, it can elevate everything else in the hospital. So for the cardiovascular services, we've begun a standardization to our quality and safety metrics that we use for the Bloom Cardiovascular Institute across the entire health system. It will continue to enhance the service offerings that are provided here. We're about to embark on a reconstruction of space here at the hospital that'll be dedicated to our cardiovascular institute. And in part of that space, we will have a clinic of the future that is really designed to offer artificial intelligence and other technologies to make the patient experience very futuristic. It'll be an exciting offering to provide to the community. For neurosciences, we've already started neurohospitalist program. So we have neurohospitalists that are in-house throughout the week to serve the needs of our patients with neuro needs. We've hired our first neurosurgeon And we look to add a couple of more in the summer, late summer, early fall, that will round out our neurosurgery offerings. And today we're able to do spine cases, but we'll be looking to be able to move to cranium once we have our full neurosurgery team here. And the idea, and kind of just from a high level perspective, NM's philosophy is not to, as we integrate with hospitals around Chicagoland, it's not to try to take patients and move them downtown to Northwestern Memorial Hospital, but rather grow the programmatic offerings and the clinical programs in the community so that patients can get the highest level of care close to where they live and work. And in those instances where the local community hospital may not provide some level of service. Let's say it's a transplant, for example. We have Northwestern Memorial Hospital within the system that can be a referral center for the health system. So as we grow these programs, the idea is to grow them, to keep people here. And quite frankly, there are a number of patients from this community that go down and seek their care at Northwestern Memorial Hospital. There's no reason that we can't provide those services in many cases right here in the community. So we'll look to continue to grow those offerings so that our patients can get that care here. And then the last, the program that I didn't mention in detail was our oncology service line. So we're going to be looking to grow our medical oncology services, surgical oncology. At our Orland Park campus, our plans are to develop a cancer center, and already construction is underway to help meet the needs of this community from a cancer program perspective.
All right. And I'm glad you mentioned AI in the hospital of the future, because my last question is, what advances are planned for the future?
Yeah, I think from a technology standpoint, we have the benefit now of being part of 11 hospital system within Northwestern Medicine, and the latest and greatest technologies that are available at any one of our facilities. We look to grow and develop at each and every other one. And I think it all starts with understanding the underlying quality and safety data and aligning our quality metrics across the health system so that we understand, how we're performing, where we continue to get better. Because as you see in the Northwestern Medicine ads, our goal is to be better. Best is a destination, but better is really about constantly looking for ways that we can improve the care and the experience of all of our patients. And our mission is really all about patients first. So there's from a technology standpoint, we're in the process of replacing the MRI that's here on campus at the hospital with technology that will support cardiovascular disease evaluation. Our cath lab, one of our 2 cath labs is slated to be replaced. So we'll continue to look at all of the technologies that we have here at the main hospital campus, but also as we grow the services that we offer at Orland Park, Tinley Park, and even in the facility that was opened last summer in Mokina.
All right. Thank you for your time and the knowledge you've shared with us today. That's all the questions I have.
Great.